All right, everybody, I have 1 o'clock my time, so I'm going to go ahead and get started. I'm so glad you're here and joining us today. Um, Thank you for taking time out of your busy schedules. This is being recorded, and I will be sure to share the recording with all of you so you can take it back to your teams and anybody that may have missed this and share it with them. And so before we get started, just a couple housekeeping. I will, like I said, send the recording. I'll also send a PDF of the slides after the presentation. So feel free to share that as well. You can contact me at any time. I'll use the chat box for questions. I'll answer those at the end, but feel free to type them in as we go so you don't forget something that you want to ask and make sure I answer. And I'm going to turn my video off for the majority of this, only because I have a couple videos to play and I want to make sure that they play okay and everything for you. So with that, we're going to go ahead and get started. All right. So first and foremost, thank you to the Health Plan of Nevada. It is because of a partnership with the Health Plan of Nevada that we are here in the great state of Nevada talking about this today. We are talking about a stillbirth prevention education campaign. You are able to get free materials and resources because of this wonderful partnership. So we're very excited about this, and we're glad you're here. And thanks to this wonderful partnership, this is brought to you by the Health Plan of Nevada. So this is a little bit more about me and my contact information. I love hearing from you. So if you have questions or you want to contact me after the presentation or anytime and share something with me, feel free to. You guys are the boots on the ground. You are the grassroots of this. You are the ones that are helping us implement this. Like I said earlier, we're actually based in Iowa. We're a national campaign, but we're based in Iowa. So all the staff is here in Iowa. And so we really do need partnerships like this to be able to share Count the Kicks with the clients and the patients you serve. So I've been in public health for close to 12 years. I love it. I love systems change, and I really like maternal and child health. So I hope that you get a lot out of this presentation today, that you're able to get the tools and resources you need to be able to talk about stillbirth and stillbirth prevention to the expectant parents you serve. So one of the first things I want to do is share a video, and I like sharing this video for a couple of reasons. I like sharing it because one is just a feel-good story. It's about a baby save, baby Ruby, who was saved in 2017 when her mom noticed reduced fetal movement and spoke up to her provider, and baby Ruby was saved by that. She needed to be born, and so you'll hear her story through her mom. And then I also share it because it gives you a really good overview of what Count the Kicks is and how our app works. So if you're not familiar with Count the Kicks or you're not familiar with the app, it does give just a quick overview of how to use it and why it's important. And then finally, I really like sharing it because it does a good job of showcasing that mom-to-mom storytelling. When this aired on Good Morning America, we saw about a 37,000% increase in our app downloads. It was huge. It was amazing. And so we know the importance of that mom-to-mom storytelling. We know the importance of those baby safe stories. So anytime you're working with expectant parents, whether it's a childbirth ed class, or you can send an email out with a link. We have all of these stories on our YouTube channel. We have them on our website. Feel free to share them with your expectant parents because this is what they're going to remember. I also will be sharing, I might reference some of the comments that this mom says during the presentation. So let's go ahead and take a look. Let me know if you can't hear it though. Go ahead and just use the chat, but hopefully you'll be able to hear it. It is slightly delayed, but the voiceover and everything is completely fine.
We're going to turn now to that GMA parenting alert about a free app. A mother says helped save her baby's life by tracking how often she kicked. ABC's Diane Macedo is here with that story. What is this all about?
So this mother says that everything was completely normal in her pregnancy until one day, thanks to this app, she noticed that something was off. Well, it turns out her baby was in real trouble.
For Emily and Jeremy Ecoff and 2-year-old Liam,
oh, nice.
Life with their new baby Ruby is extra precious.
We have a healthy baby girl, and we could have had a burial instead.
Ruby is lucky to be alive, and her mom says that's largely thanks to an app. The free app called Count the Kicks aims to prevent stillborn deaths by helping moms record their baby's movements.
You can just tap the baby's footprint every time you feel a movement. A movement could be a kick, a roll, or a jab.
Used at the same time every day, the app tracks how long it takes to reach 10 kicks, helping mom learn what's normal for her baby.
And we also send calendar reminders and text reminders so that moms are reminded to do it once a day in the 3rd trimester.
It's just one of a growing number of apps helping parents through pregnancy and labor. For the Ecoffs, everything was going smoothly until one day last month.
The kicks were not happening as frequently as they usually did. And when she did move, it was really like soft, subtle, not like hard kicks like normal.
Emily knew from the app that her baby normally kicked 10 times in under 10 minutes. So when she only logged 3 kicks in an hour, she rushed to the hospital.
All of a sudden, they came in and said, you're going to have an emergency C-section.
The umbilical cord had wrapped around the baby 3 times, limiting her movement. Doctors delivered Ruby just in the nick of time.
Not only has Ruby been saved, but potential generations have been saved.
She sleeps about 23 hours a day.
4 weeks later, Ruby is now home, healthy, and sleeping like a baby.
Doesn't get much cuter than that. Now, the app was made in Iowa, which is where that family is from, but the creators say it's now spreading nationwide, thanks in part to Ruby. Since the news of her birth, the app has gained more than 5,000 new subscribers. So, Robin, the app saved Ruby, and by raising awareness, she may end up saving many more.
So yeah, like I said, a feel-good story there. So feel free to share that from our YouTube channel with your expectant parents, and we'll talk about it a little bit later on. Before we go too much further, though, let's make sure we're all on the same page when we're talking about stillbirth today. So what we're obviously talking about is stillbirth, which is the loss of a baby after 20 weeks of pregnancy. It's further classified as either early, late, or term. And on average, 23,500 babies are born still every year in the United States. Miscarriage is usually defined as loss of a baby before the 20th week of pregnancy. And infant mortality is death of an infant before his or her first birthday. On average, around 22,000 infants die every year in the United States. And so what I want to draw your attention to on this slide particularly is the fact that we are losing just as many babies to stillbirth as we are to infant mortality, yet nobody's talking about it. Nobody talks about it like we talk about the SIDS campaign and the back to sleep, SIDS prevention, which is important. And I'm not underscoring that at all. But what I want to do today is I want to give you the tools and resources so you feel comfortable talking about stillbirth and stillbirth prevention, so we can change that fact. So we can be talking about it and we can help decrease the stillbirth rate in the United States. If you think about it, that's about 65 babies a day, or a school bus full of kids that are born still every year in the United States. So when we look a little bit closer about the numbers, nationally, 1 in 169 pregnancies ends in stillbirth, and the racial disparities are huge. Black women, it's 1 in 96. Black women are 2 times, sometimes 3 times, depending on the state, more likely to experience a stillbirth over their white counterparts. Hispanic moms, 1 in 199. Indigenous women, 1 in 138. White women, 1 in 204. Asian Pacific Islanders, 1 in 233. Families are 10 times more likely to lose a baby to stillbirth than to SIDS. So take a little bit closer look at Nevada numbers. Based on the most recent 5-year average of the stillbirth rate is 6.8 in Nevada. This is why we're so excited that the Health Plan of Nevada has partnered with us so we can help decrease that, because you can see by that chart, that red line is Nevada, significantly higher than Iowa's rate and higher than the national average, which is that blue line. On average, Nevada's losing around 245 babies a year to stillbirth. In Iowa, we are saving 1 in 3 babies from preventable stillbirth, at-risk babies. That would be equivalent to around 78 Nevada babies on average every year in Nevada. When I talk about that 1 in 3 and what we're saving at-risk babies here in Iowa, I'm talking about this 32% reduction that we have had here in Iowa in the stillbirth rate. If you look at this chart for Iowa data, you can see that the teal dots are Iowa's stillbirth rate by year, and then that dashed or dotted line is the trend. line, and then the red line is the US stillbirth rate. And so you can see we've been in a downward trend since 2008, which is exactly when Count the Kicks was created. So you can see, and in 2008, that's the highest we are on this chart. Count the Kicks was created by 5 Central Iowa women who all experienced stillbirth or infant loss in the early 2000s. I'll talk about them here in a little bit, but what I want to show is that we have seen a 32% reduction in the number of stillbirths since the inception of the campaign. Public health officials have said here in Iowa that there's nothing else going on in the state that would have made such an impact on the stillbirth rate. It's not like smoking has dramatically decreased, which is a risk factor, or obesity has decreased, another risk factor, or every pregnant woman got a doula, which would be amazing. No, the only change was the inception of Count the Kicks. And so in the first 5 years of the campaign, we saw nearly 39% reduction among the African-American stillbirth rate. And so when we talk about saving 1 in 3 at-risk babies, or 32%, that's what we're talking about when we talk about your Nevada numbers. So you heard me mention earlier about the racial divide and the disparities around stillbirth. And so I think it's very important that we take a couple minutes and talk through this and why this is, and thinking through as an organization what you could be doing to help close those gaps. So researchers point to the following as causes of the disparities: things like systemic racism, toxic stress. Research shows that years of being treated unequally and or unfairly, essentially being an African-American woman in a systemically unjust society, and everything that comes with it, has led to real and pervasive health issues for Black women. Epigenetics, those physiological variations that are caused by external or environmental factors, switching genes on and off, affecting how cells read those genes, those changes in the DNA sequence. Predisposition to certain conditions that may lead to stillbirth, like gestational diabetes, high blood pressure, all are linked to maternal stress, and experts say Black women are less likely than other races to receive early treatment to those conditions. Access to healthcare, socioeconomic barriers, but research shows education is not a determining factor. A college-educated Black woman is still more likely to lose her baby than a high school-educated white woman. So what are we doing to reduce those disparities at Count the Kicks? We have a health equity coordinator on staff. We're always looking for funding opportunities to reduce racial disparities that persist in stillbirth. We're an inclusive organization with 100% board and staff trained on anti-oppression and structural racism. We are improving our programming based on lived experiences of women of color, holding focus groups and listening and hearing what they're saying, and then improving our programming based on that. We're working within marginalized communities, and we're working outside typical healthcare settings. Things like we've created a faith-based toolkit and a beauty salon toolkit, because what we've heard from community conversations and focus groups is people are getting their health information from a variety of different sources. And it's not always their healthcare provider. It might be their mom or grandma or their minister. So we created these toolkits in Iowa and piloted those there, and it's been really successful. We have an app in 12 languages. We have culturally appropriate educational material. We have videos, printed educational materials, and FAQs in multiple languages. We have a lot of great digital resources and tools available completely free for you on our website. So feel free to peruse that. So let's talk a little bit about the research and evidence as well. I don't know if you're really into research and evidence and you like reading journal articles. If you do, that's awesome. We have a whole page dedicated to it. If you don't really like it and it's not for you, that's totally fine too. I've kind of broken it down, but if you do read one research article, this is the one I want you to read. This is the one that started it all, the one on your screen right now. So this was a public health research study out of Norway that showed when expectant parents were educated on the importance of tracking fetal movement in the 3rd trimester, that the stillbirth rate among this cohort of pregnant women actually decreased around 30%. And so what's so important about that, one, is that decrease, but two, some of our founders who I talked about earlier were at a conference and they heard these researchers talk about this study. Dr. Ruth Fretz, who's now on our medical advisory board, and a couple other researchers had done this study out of Norway. And when they presented this information and our founders heard this, they thought to themselves, this was back in 2007, they said, this is amazing. We can do this. We can create a campaign just like they did in Norway. We can create tools and resources to educate expectant parents on the importance of tracking fetal movement in the third trimester and to speak up if they notice a change. And we can create tools and resources for providers and those who work with expectant parents to talk about stillbirth and stillbirth prevention. And that's exactly what they did. They came back to Iowa. They worked with Iowa Department of Public Health and a local marketing company, and they created Count the Kicks, the bright, the colorful, the materials that you see now. That was all created in 2008. The founders, who I mentioned earlier, all experienced stillbirth or infant loss. They know more than anybody, or that's gone through this, that have said, we wanted this to be uplifting and empowering and mom focused and mom centered. And so that's what they created, was this bright and colorful ways that you can educate your expectant parents and for expectant parents to understand what's normal for their baby and to speak up. Because if you look at this quote here from Dr. Ruth Fretz, I pulled this out of the research study that says, tracking fetal movement is a non-invasive way for expectant parents to monitor their baby's health in the third trimester of pregnancy. Babies can be saved when expectant parents are educated on getting to know their baby's normal movement patterns starting at 28 weeks and to speak up if they notice a change. And so you're going to hear me reference that a lot, that normal movement pattern, because every baby and every pregnancy is different. So it's really, really important that we are educating our expectant parents about understanding what's normal for their baby and their pregnancy. So you'll hear me reference that a couple times. So a couple other research studies that I wanted to share with you today. This one quote from the top here is from a research study, and it says, one potential side effect of routine monitoring of fetal movement could be an increase in prenatal visits, either outpatient or in hospital. However, most research has not found this type of increase to be true. Usually, the fetal movement count is reassuring to pregnant women and prevents unnecessary visits. And we have found that to be true. We have done our own research with the Des Moines University and the Harkin Institute of our app users. So we have thousands of app users, and they were surveyed, and this was the research that came out of it. 84% of the app users stated that regular tracking was associated with feelings of bonding. So they could encourage that significant other coming and looking at the tracking, or big brother or big sister coming over and feeling baby move, and that bonding, or just mom, expectant parent and herself, and just really spending that time focusing on baby is really important and valuable. And then I also found that 77% of app users reported feeling less anxious, because if you think about it, what this app does and what this education does is it educates and informs expectant parents and gives them actual data on what their baby's normal movement pattern is. So now they're highly educated and informed about when to speak up and how to speak up. And they have it in the palm of their hand, that they can go to their provider and say, look, this is not my baby's normal movement. Here is my average. And then they can have that and share. The research also stated that using an mHealth app to empower mothers to monitor their baby's fetal movement, preliminary research shows that the mobile health app increased awareness of a change in fetal movement and a reduction in stillbirths. So just some other benefits that fetal movement monitoring has, things like reduction in preterm birth rate, fetal growth restrictions are identified earlier. I think it's also important to note that women who have stillbirths are at substantially higher risk for severe maternal morbidity than women who have had live births, regardless of the cause of fetal death. And then I love this quote from a researcher that says, due to the low cost and potential benefit, it is recommended. Decreased fetal movement can indicate a need for more evaluation and has the potential to save lives. And that's exactly what it is. It's just another way to check on baby to make sure baby's doing okay. If you notice reduced fetal movement, you can go in, and then with your medical team, they determine the next steps. What's the protocol? Is it the biophysical and the non-stress test? And that's what they do. It's not like every time you notice, every pregnant woman notices reduced fetal movement, baby's automatically born. That's not the case. And in fact, a lot of times things can be caught early, like it says right there. Maybe you go in and you notice reduced fetal movement and baby's trying to get born early. Maybe they want to come out at 32 weeks instead of 40 weeks. And so maybe providers can do something to ensure baby stays in there safe and sound for a couple more weeks. So just some things to think about. Again, if you're really into research and you like reading all those journal articles, I have found it very, very thoughtful and educational, but we do have a whole page dedicated to this. So feel free to check it out and share it with anybody on your team. So now what you're all here for, how do you do this? How do you talk about it? And how do you share it with your expectant parents? This is probably the only presentation maybe that you've ever been to where I want you to multitask. I want you to pull out your phones if you haven't already, and I want you to go to your app store, whether it's the Google Play Store or the Apple Store. And I want you to search Count the Kicks. You'll see the little yellow icon, the clock, show up and you can download it. I want you to download it. It's completely free. I want you to do this for a couple of reasons. One, I want you to become familiar with it because you're going to be the one talking to expectant parents about it. So I want you to download it. I want you to use it. I want you to see all the features so you can pull out your phone next time you're talking to somebody who's pregnant in the 3rd trimester and say, look how easy this is. Let's set up your profile together and do a session and share that. So I really want you to become familiar with it. I also want to highlight some of the key features for you. One of my favorite features is that you can restart your session or delete a kick. I know we're busy individuals, you can set daily reminders, but I'm potty training a 3-year-old right now. So if I were pregnant and I'm trying to count kicks, we want people to count daily, preferably around the same time. And so let's say I sit down in the afternoon, that's when I normally count, and I'm trying to count and my toddler's running around, my 3-year-old's running around, and he says he has to go potty. If you've ever potty trained, you got to get that kid to the potty. And so you might have to jump up as fast as you can while you're 8 months pregnant and get that kid to the potty, which means that interrupted my kick session. I'm going to have to restart it. Or that same 3-year-old comes over and taps that little footprint way too many times before I was ready. And I need to delete a kick. Because when you're ready to start counting, when your expectant parents are ready, all they have to do is sit down, lay down on their side, get relaxed, put their feet up, get comfortable, and they hit that little footprint. And every time they hit that footprint, they want to hit it every time the baby moves. A timer will start, and they'll do that until they get to 10. And after 10, they'll see a graph similar to what you see behind that image there on the top right. You can see after a couple sessions, the app starts showing what's the average time it takes baby to get to 10 movements. So users get a very good visual representation of what's going on with baby's movements. So it's very easy to see. It's very easy to see that baby right there on that screen. Its normal average time is around 15 minutes. You can see about every day, it's been around 15, 16, 17 minutes. That's that baby's normal movement. Again, you can set daily reminders. We want them to count daily. So you can do that within the app. So then when it's time to count and we're busy as a society, we get that little vibration on our phone that says time to count. Let's count kicks, something fun like that. They'll get that reminder. So highly, highly encourage your expectant parents to set the daily reminder. You can also review kick counting history, and you can download history to share with provider, family, or friends. This is also a very important feature, especially as we've been dealing with this pandemic for almost 2 years. Appointments have gotten stretched out, or telehealth. What a great opportunity to download the data and send it to your provider to say, I just want to show you this. This is what I'm tracking. What do you think about this? This is what I'm seeing, and just sharing it with them and having that gap filled there with that type of communication. You can count the kicks with twins. You can track future pregnancies on the same profile. So you don't have to recreate a profile every time you get pregnant to use it. And then you can always go back and see, that previous baby and things like that. It's just kind of a cool way to keep track of that data. You can also manage multiple devices registered to your account. So you could be counting on your iPad and your phone and your watch, or your significant other or mom or grandma could log in as well to see that. So that's a cool feature that they can just see how baby's moving. It's another way everybody can bond with baby. And now it is available on Apple smartwatches as well. So let's say you're in bed and you're 8 months pregnant and you get that little ping on your watch that says it's time to start counting, and your phone's all the way downstairs. And so you can just do it on your watch and it syncs automatically to your phone. So I see we have a question. Yes, so the question that just came in is it recommended to count fetal kicks just once daily? That the recommendation is to count daily, preferably around the same time. Great question. All right. So another important feature that I want to highlight is this newest feature that we just integrated into the app. It's a strength tracking and notes feature. So research says that not only should expectant parents be paying attention to the strength of their baby's movements, or the amount, but also the strength of those baby's movements. And so after expectant parent counts, they tap their footprint, they get to 10. What's going to happen is that middle screen that you see there is going to pop up, and it's going to say almost done. Please fill out the following fields to finalize your kick session. How strong was baby moving today? And they have the option to fill in basically 1 through 5, their little feet. They'll color them in when they tap them. And so if you click on that little eye, it pops up an information, which you see on the left-hand side of your screen, that talks a little bit more about what those different icons mean. So if you were to fill out 1 footprint, that really means baby's movements were soft, it was fluttery, kind of like if you've been pregnant before, those early movements that you feel, they're very light, all the way to fierce, where you fill out all the feet. And those are your strong movements. You can usually see them from the outside as well. And so then moms, expectant parents can fill out additional notes. So maybe they just want to make a note saying, I got interrupted 5 times, or I was gardening all day, or I love this app, things like that, whatever. It's just for them to kind of track, what's going on. A mini diary, they could share it with their providers if they want to be tracking other things with it and just keep track of their notes. So then after they click finalize session, it's going to open that screen you see on the right, and that's the final screen. And this is showing the user the normal amount of time it's been taking baby to get to 10 movements, and then the strength of those baby's movements per session. So you can see this baby has moved quite a bit around, that's probably like a second or less. I was doing it really fast, but then you can see the top screen shot up in that chart. So that's a very visual representation showing me that baby's movement pattern changed during that session. Not only that, but also the strength changed. It got a lot weaker. If you think back to that story of baby Ruby's mom, when she said, her movements just felt softer, they felt weaker. And that was also a sign that she needed to be seen. And so there's really no right or wrong answer when they're filling these feet out. Basically, what we really want to educate moms and expectant parents on is that we want to say, it shouldn't decrease, right? It should always be around the same feeling, that same strength every time. So if it does change and it becomes a lot weaker, then that's something you want to notify your provider about. There is some research out there, and I don't want to confuse you, but I do think it's important to say, there is research out there that sometimes if babies have almost a wild or sudden surge of movement, almost, some expectant parents have described it as aggressive, violent even, they would notice it. That would also be an indication that they should call their provider. So I just want to reference that and share that information as well. It's just what we really want to stress is understanding what's normal. That's not normal, right? That was not my baby's normal movement. And so I need to speak up, trusting that gut, that mommy instinct. And so this is a really cute short video about how to use the app, some of the new features. This is another video you could share with your expectant users, expectant parents. So let's go ahead and watch.
The Count the Kicks app, a cutting-edge, powerful tool for expectant parents in the 3rd trimester of pregnancy, has a new feature to help you monitor your baby's movements. The new strength feature allows you to rank the strength of your baby's movements on a scale of 1 to 5, from fluttery to fierce. Research shows paying attention to the strength of your baby's movements is vital. If a baby's movements becomes weaker, studies show this could be a sign of potential problems, and expectant parents should alert their doctor. The free Count the Kicks app now gives you the option to take notes on your session. Our app is available in 12 languages in the Apple and Google Play app stores. It is a simple and non-invasive way to monitor your baby's well-being every day in the 3rd trimester. Features include kick counting history, daily reminders to count, and the ability to count for single babies and twins. Simply tap the footprint every time you feel a kick, roll, or a jab, and the app will time how long it takes your baby to get to 10 movements. Log in to save your kick counting data and get to know what's normal for your baby. Be sure to speak up and tell your doctor if you notice a change in the strength of your baby's movements or how long it takes your baby to get to 10 movements. Hospitals are open 24/7 and are ready to listen to your concerns. Join the community of expectant parents who are in tune with their body and their baby by counting kicks daily in the 3rd trimester. You can also find it on Apple Watch. Download Count the Kicks and start counting today.
So yeah, just another video that you can share with your expectant parents. Okay, so you know about the research, you know about the data, you know how to use the app, you're playing around with it right now. Let's talk about how you talk about stillbirth with expectant parents. You might be thinking, I don't want to scare moms. I think it's important to know that pregnancy is full of risks that we talk to moms about, and stillbirth is another risk that moms deserve to be educated about. Just like we talk about not drinking, we talk about taking a prenatal vitamin, things like that, and why we do those things. This is another reason why we should be tracking fetal movement, because it can help prevent preventable stillbirth. Stillbirth just happens. There's nothing we can do. There can be warning signs. Reduced fetal movement is one of the earliest signs baby's in distress. We just need to make sure expectant parents know what to look for. Her baby's always active. It's not a concern. I'm gonna reference this a couple times because you're going to get it a lot when you talk to expectant parents. And I think it's really important to note that babies are active until they aren't, and cord and placental accidents can be sudden. So we really want expectant parents to know and be educated on what's normal for their baby so they can quickly and easily notice a change. You know, it's great they have an active baby. A healthy baby is an active baby, but it's also really important to be tracking those movements so that we know what normal is and how active our baby is, so we can speak up if something changes. Plus, it also helps bond with baby, and you can include significant others and siblings. So there's just a lot of other great value to it as well. She's almost at her due date. The risk of stillbirth actually increases as a mom approaches or exceeds her due date. So what about talking to expectant parents who have had a stillbirth recently or previously about fetal movement? You would do the same thing. You would follow the exact same protocol. The biggest difference is you want to be talking to those most at risk of stillbirth, like those who have had a loss before, starting at 26 weeks versus 28 weeks. Is when anybody that's at higher risk, you want to start talking about fetal movement monitoring and doing that around 26 weeks. Feel free to talk about the previous stillbirth and acknowledge her child that was born still, asking about the name, the gender, if you don't know. That's really empathetic and ways you can connect. Staying away from medical terms like fetal demise, asking if anybody has talked to them about the importance of tracking fetal movement before. I can tell you from conversations we've had with a lot of our lost moms that have said, you know, I have 2 other living children and I had no idea I should have been doing this, and nobody said anything. Why didn't anybody tell me about this? Why? And so what we're trying to do today, and what our mission is, to change that why into, I'm so glad I knew about this. I'm so glad I spoke up. And that's your role. That's what you're going to be doing, is you're going to be educating so that they do have that knowledge and they can say that. So again, you want to be starting to talk about fetal movement monitoring at 26 weeks if they're high risk, 28 weeks otherwise. using motivational interviewing techniques, things like, tell me what you know about the importance of tracking your baby's movements. Let's talk about how to track your baby's movements. We want to count each day so you can learn your baby's normal movement pattern. And I really want you to speak up if you notice a change. It's all about empowerment, right? And so really making sure if you are not you're working with a client and you're not their provider or nurse, making sure they know who to contact if they notice reduced fetal movement. Is there a phone number? No matter what day or time, letting them know that providers are there for them. If you are a provider listening today, using language, saying things like, I'm here for you. I want to know if something's not feeling right or something's going on. That's my job. We have heard time and time again at how comforting those simple words have made expectant parents feel, because we don't want to be a bother. That's what we think. And we're not a bother. You are your baby's best advocate and you're your own advocate. So making sure that they speak up if they notice a change. Talking about how movements are jabs and rolls and pushes, anything but hiccups. Hiccups are involuntary, so they don't count. And of course, sharing the app, going through the app with them those first couple times, asking them, if you're a provider in a clinic setting in Iowa, we have to take the glucose test in the office, and then we have to wait there for an hour, and then we have our 10-15-minute appointment after that. And so if that's how it is there in Nevada, that's a perfect time to say, okay, you took that awesome liquid, go ahead and sit here, read this brochure, download the app, and then we'll talk about it. So we'll talk a little bit, some other additional ways you can integrate this into your workflow here coming up. But let's go through just a little bit more of the common myths that you might hear when you're talking to expectant parents, or maybe you're thinking yourself, like, let's just address them. Here's that active one again. And again, I reference it because I guarantee you're going to get it. I just go back to that tracking your baby's movement every day takes that guesswork out of knowing if your normally active baby has slowed down. That's great. Your baby gets 10 movements in 5 minutes, but then you don't have to think about it. You don't have to think, oh my goodness, was it 15? Was it 10 minutes? Was it 20 minutes? I don't know because I'm busy and doing things. You have all of that data in your hands then. Again, only those experiencing high-risk pregnancy should pay attention to the baby's movements. No, we want all expectant women should be educated on count the kicks and getting to know what's normal for their baby. Here's a big one. My baby should get 10 kicks in 2 hours, 10 and 2. We hear that all the time. Every baby is different, and the recommendation to expect 10 kicks in 2 hours is actually outdated. Current research indicates that moms should work to understand the normal amount of time each day it takes their baby to get to 10 movements each day. And I'll tell you why. There's a research study on our website about this, but basically what it says is, as human beings, we get stuck on those time limits, those alarm limits, basically is what it is. And we don't want to set that for expectant parents, because let's say I'm counting and I've been counting and I know my baby's normal is around 15 minutes every day. And, in the back of my head, I'm like, great, it's within 2 hours. That's awesome. But one day I'm counting and it takes an hour and 47 minutes. And I think to myself, no problem. I got it within 2 hours because that's what I was told, 10 and 2. But that is a problem, right? That's a significant change for my baby who's normally getting 10 movements in 15 minutes. So, just really focusing when we're talking to expectant parents that they should be getting, 10 movements, figuring out what their normal is and looking at the average time on the app is really important, and just speaking up if they notice a change. 9 times out of 10, I think research shows it's almost like 15 minutes or less. But again, I wouldn't be sharing that with expectant parents. It's really just getting to know what's normal for their baby. Here's another big one. I can just use a Doppler device to monitor my baby's well-being. Change of baby's heartbeat is one of the last things to occur when a baby is in distress, but a change in baby's movements may indicate potential problems before the actual changes in the heart rate. Plus, if you're not trained on how to use it, it can be very difficult to decipher what's your heartbeat or baby's heartbeat. So unless they're medically trained under the guidance of a healthcare provider, we really do not recommend using a Doppler device. And that goes the same for if you're a clinician. There's a protocol in place, right? If somebody has reduced fetal movement, you don't just do the Doppler and move on. You usually do like the NSTs and the biophysicals if needed. there's that pathway in place. Here's another popular one. If baby isn't moving, I should drink cold water or eat something sugary to get baby moving. Research has actually moved away from the idea that sugary drinks and the like are a good way to get baby to move. Kick counts are actually best monitored without interventions. If baby isn't moving like normal, parents should speak up right away. Because if you think about it, why are we forcing a baby to move with all of these other outside things if baby isn't moving already on their own when they should be moving, right? If they're not moving during their normal movement time and things like that. It's like you and I, when we're sick, we just want to sit on the couch and lay around and do nothing. We're conserving that energy. We don't want to move as much. Same thing with baby in utero. If something's going on, baby's not feeling good, something's low fluid, umbilical cord constricting, whatever it is, they're not going to move that much. So we don't need to try to force and intervene with that. We should get it checked out. Babies kick less than near the end of pregnancy. You might hear this a lot if you work with multi-generational houses or grandparents. I heard all of that stuff from my grandparents, and it's important to know that babies don't run out of room. The types of movements change. There's more jabs, fewer rolls. But if an expectant parent is monitoring their baby's movements at the same time each day, it should still take about the same amount of time to feel 10 movements. Triage doesn't need this information. I think some people think that because we're in triage, we're automatically going to deliver. That's not the case. I went to triage 3 times with my daughter and got sent home every time. Everything checked out perfectly well. And so it's a perfect place to have this information. Whether they come in for reduced fetal movement or discharged or whatever, having this information there that the nurse can talk to during and have on discharge papers is really, really important. So anything that you can share, we have all the free materials thanks to our partnership with the Health Plan of Nevada. So please take use of that. So what are some other ways you can integrate this? Whether you're a home visitor, you're WIC, you're a nurse, you're an OB provider, there's lots of different ways you can do this. And I would love more than anything to talk to you more individually about it, of what will work for you and your workflow. So these are just a couple ideas of how you can do this. You could use a format check-in. Let's say you are in a clinic and you can have your front desk staff trained to hand out a form every time somebody comes in who's in their 3rd trimester. Because remember, we want to be doing this and talking about this at every single appointment, every single time you see somebody in the 3rd trimester. Maybe you're a WIC or home visitor and you have family care plans or intake documents. Could you add questions about, are you currently pregnant? Are you trying to get pregnant? What trimester are you in? And then flag those for later use. So if they're in their 1st trimester now, what date do you want to talk to them about this, right? Doing that math and that calculation so that you can flag it in their chart next time you see them or somebody else sees them. If you have an electronic health record, integrating questions like that pops up every time somebody comes in their 3rd trimester, reminding you to ask about fetal movement. Anything that you can do that can help make this easier to remember, and part of your workflow will obviously be better. This is our gold standard discharge papers or after visit summary. So if somebody comes in and they get discharged, everything checks out good. We helped write this language. So this is the type of language that you can use in your own setting. I'd be happy to send this to you electronically. Feel free to contact me. We can talk through this. This is another example of a clinic form that was created to hand out to expectant parents while they're in the waiting room or in their patient room waiting for the doctor. It's just a way to start that conversation. It's kind of asking the questions the provider might ask, and then the provider can follow up with like, oh, I see that you marked, no, you haven't been counting. Let's talk about that. What's the barrier to that? Things like that. And then the expectant parents can detach the side there and take it home and write down their doctor's name and their phone number and where to go. Again, making sure your expectant parents know who to call if they notice reduced fetal movement. I know Nevada has some very rural areas, just like Iowa. And so if you have expectant parents that you're working with that have a 40-minute drive and they notice reduced fetal movement, they have that long of drive to get to their nearest hospital or birthing center, they need to get in the car. They can't just sit around and wait for a voicemail or something like that. And so making sure that especially your rural moms know about this and know how to speak up and when to speak up. This is another example from a community-based organization, Celebrate One out of Ohio. They serve around 2,000 expectant parents every year, and they serve them like once, like they see them once, they have one shot giving them all these education and resources. And so every expectant parent that they serve, they have them fill out this form. And so what we did is we worked with them to add language around Count the Kicks and the app. And so you can see that they're at the middle of the form. So it's just simple things like that that we can add, and we can help you with that. So feel free to reach out. Here's another example. This is a childbirth education plan. This is available on our website. If you're a childbirth educator, or childbirth educators, or this is a really great tool to just use and take pieces of it if you're a WIC consultant or a WIC nurse or home visitor. You can easily pull out a lot of these resources and make it work for your needs. So again, how do you implement this? You become familiar with it. You order the materials, which we're going to talk about in a minute. You review all of the awesome resources that we have available for free on our website. Make sure everybody knows about this. This, like I said, is being recorded, so send it out to your team members. And then I, of course, love systems change, so integrating into your care plans and touch points as much as possible to make this as easy as possible. So here are your educational materials. Thank you to the Health Plan of Nevada. These are completely free for you. You have promo posters in English and Spanish. That's what you see on your screen. There's how-to posters in English and Spanish. There's app reminder cards, all in English and Spanish, and brochures. And so it's super simple. You just go to countthekicks.org. This is another part of the presentation where I'm going to say, go ahead and multitask, order these now so you don't forget. And you just click on order materials right there. Super easy, super simple. And you get this awesome map of the United States. You're going to click on your wonderful state of Nevada. And it's going to open up basically a page of all the different resources available to you. So we have those app reminder cards. Those are great to have handy at clinics, or just when you're out and about in the community. You can put them in folders if you hand them out, brochures. You can post in at check-in and check-out, waiting rooms, patient rooms, promo poster, put those everywhere. Restrooms, patient rooms, waiting rooms. If you are a community-based organization and you're traveling out in the community a lot, I highly, highly recommend that you keep, a stash of these materials in your car. Because like I said, if you think back to the very beginning, I said, you guys are you're our feet on the ground. You're our grassroots. So take these, put these in your local libraries, put these in your chambers of commerce. Like anytime the public is out there, you can do this, you can place this, and it's completely free. All available in English and Spanish. You also get to select how many you want. So a pack normally comes in a pack of 25. They come bundled very nicely together. You can get as many as 250 for the brochures and things like that. And it's free. Can't stress that enough. So helpful tip, go ahead and register so you don't have to do that again. It could remember your order, things like that. And you just confirm, and that's it. So one of my favorite things about doing these presentations is we get notified every time somebody places an order. And so then I know I get all these emails saying, so-and-so placed an order. So I know that means you listened and that you were multitasking and that you were listening and hearing and hearing about this great partnership. So I'm super pumped about that. So hopefully you order your materials if you haven't already. We also have additional free resources, our Count the Kicks Academy. These are fantastic resources. We have an academy for providers and parents. It's just kind of a suite of digital tools. If you are meeting with people more telehealth or over the phone, you could send them to the Academy for Parents, and it has those YouTube links I talked about. It has paper kick charts and things like that. So feel free to just spend some time on the website and look around and see what you find useful. And then another great resource for you is our Count the Kicks ambassadors. So we have highly, highly trained individuals, volunteers from all over the United States. And you are lucky you have a wonderful ambassador, Julia Taylor, for Nevada. A lot of these ambassadors are lost moms. They have found us after, unfortunately, their stillbirth has happened. And they're passionate about making sure this doesn't happen to anybody else. And so they're highly educated. They can do things like presentations like this. They can do in-person presentations because, like I said, we're based in Iowa, but look how many there are. There's so many states that have ambassadors. And so we're so lucky and grateful for them. They can do media interviews. I know the Nevada ambassador has already done several media interviews for us. She helped us also get some billboards put up. So she's just phenomenal. So make sure if you ever need something in person, she's in the Reno area, but I do know she's willing to travel. So feel free to reach out to me. You can also find her contact information again on our website under ambassadors. And then of course, why do we do this? We do this because of these beautiful, beautiful babies looking at you right now. These are just a few of over the close to 100 baby saves that we know about. These are expectant parents who have had their baby and they say, you know, I was using your app. I noticed reduced fetal movement. I spoke up and my baby's here safe and sound because of you. So thank you. We know there's tons more out there. These are just the ones that have contacted us. So this is Nala. You're going to hear, I think maybe her video here in a minute, Eva, Everett, and Luna. And then I just put Eva's mom, Yeli's quote up there because I really like it. And you know, at the end where she says, I highly recommend the app to all the expecting moms out there. Happy and healthy deliveries to everybody. So next steps, obviously download the app. You should have already done this. Practice using the app, practice, you know, maybe do some role playing with your team about how you're going to talk about this. Hopefully I gave you some good, helpful tips about bringing it up, when to bring it up, making sure you share this information with the team, ordering the material. We also are very fortunate because of our partnership with the Health Plan of Nevada. We have an online CE training. I'll send you the link so you don't have to scribble that down. But if you just use the code SAVEBABIES-NV, you can take this online credit, 1.5 CEs, completely free. So feel free to do that. And then here is Nala's, who you just saw a picture of. This is why we do this. So let's watch.
She came back in after she had me put on the monitor and stuff, and she's like, we're just gonna take her. And I'm like, what? And she's like, you know, her heart rate is dropping every time you have a contraction. I was already scared, you know, because I was a high-risk pregnancy. Well, I basically learned from the doctor's office, the little yellow sign that was right there. When she started moving, I was very alert with her movements, you know. That was what I lived for, just because I wanted her to, you know, her to make it and survive. When she started moving, she moved, and she was consistent. It was always at a certain time. Nala was a kicker. When she started kicking, she was kicking. And this day, she wasn't moving at all. I started drinking cold water. I mean, I was drinking so much, my stomach was hurting to make her move. And she didn't move at all for me at all that time. So I'm just like, okay, I'm gonna get her checked out. It was the heart rate that was dropping. Like they said, her heart rate would drop real low every time I would have a contraction, and they were like back to back. She thought that it would save the baby, so she pulled her out. She was like, it's a good thing you came when you did, you know what I'm saying? Because if you wouldn't have, you know, we probably wouldn't be having the same outcome. I think about it every day, like, oh man, what if, you know, what if? Definitely to pay attention and count the kicks, you know. I feel like it's important just because had I not, you know, knew to do that, Nala wouldn't be here. Don't second guess yourself. Don't feel bad or stupid. Don't worry about insurance or the emergency room bill. Go check on your baby, you know, because your baby might not be here. You just pay attention, you know, seriously. Like, it's your baby's life.
So I like what Dana says at the end, where she says, you know, just don't worry about the bills, the insurance, just go check on your baby, because the risk far outweighs the, you know, if everything's good, that's wonderful. So go check on your baby. I just love that. Connect with us. We have Facebook, Instagram, Twitter. Sign up for our newsletter so you're always in the know. Julia's contact information is right there too, so you can contact her directly. You have my contact information. And that's all I have for you today. Again, thank you to the Health Plan of Nevada. So excited to be in the great state. I am happy to answer any questions. Otherwise, you guys are free to go. I will send all of this information out to you here in the next day or so. And thank you. I'll wait for just a couple minutes to see if any questions pop in. But otherwise, you can sign off. Thanks, Tori. Thanks, Amber. Thanks, Katie. I hope you all get some rain. Maybe I can send it your way. Thanks, June.